I don't have a doubt in my mind that in 5 to 10 years, continuous monitoring will be the standard of care. And somebody needs to supply that technology. And this is spot on what we're doing in our company. Yeah, so the whole company was founded in Ålesund, Norway. And the foundation of the company was focus on the nurses. So it all comes from making everyday life easier for the nurse. The original idea was more of relieving the physical strain on nurses, but along with the physical strain on the nurses, also the psychological strain on nurses, the stress. So that kind of grew into the Ably Lung 1 system, where we focused on censoring, making that overview for the nurse so we don't have the insecurity of being focused on one task while forgetting what's happening on the rest of the ward. We're very focused on vital signs measurements, and the reference is a manual measurement. So the nurse with the clock and counting heartbeats or counting breaths. And then that's the respiration rate. But the respiration rate is so influenced by a lot of parameters. So just seeing the nurse can, make the patient hold their breath. So what we're gaining actually here with technology is that we can measure respiration rate without actively being present with the patient. You get a more objective picture of the respiration rate. And in a clinical sense, that is where the value is. It's not like we are an engineering company who's dug down into our lab, developing our electronics and our algorithms. It's actually done quite closely in collaboration with our partner hospitals. So whenever we have something new, we test it out, we get feedback, we adapt and do upgrades all the time. Currently, we are working with 4 hospitals, and we have 2 where we are implementing pilots, but also doing a lot of co-development, especially regarding the user interface. Because one thing is having great technology, we have that, but that needs to work for people, humans. And there's a whole psychological interface that we kind of need to adapt and adopt. I can take more of a concrete example where we actually did a time study in a hospital ward in Bavaria. They had 35 patients, and doing these vital measurements, just doing those corresponded, when you collected everything from actually taking the vital sign at bedside to logging it into the system, to pushing it into the EMR, and all of that workflow basically. That corresponds to 2.5 full-time position on just that ward. We're moving into an era now where the complete healthcare system in the world is being upgraded and taking in more digitalization. So everything is happening right now. And that's why it's so exciting to be in this industry right now.